in listen-only mode.
Wow, good afternoon, everybody. This is Eric with American Business Systems and want to welcome you this afternoon. As you can see, we've got some information on the screen. If you are looking to call in this afternoon, you will want to pay attention to that number, that 646 with that access code 251 706 813 and pound. And then you're going to have an audio pin that you'll need to put in there. And we'll discuss that a little bit more in just a moment. For those that are brand new to our webinars today, we want to let you know that we certainly welcome you here today. And the title or the of what we're going to be going through is just an open call-in, a Q&A with ABS CEO Patrick Phillips on starting a medical billing business. Folks, it is very, very rare that we ever have an open call like this, but we have been thinking about it. We've interviewed licensees, we've interviewed other people, and we decided we wanted to interview you today personally. So it is an open call in today, and you're going to certainly want to pay attention to, again, if you missed that phone number here, we will show you that to you again. If you would please, if you wouldn't mind, clicking on that little hand icon, that will indicate back to us that you're hearing us loud and clear. So let me see if some hands are going up. See them already. Marcia and Glenn. And let's see, Ron, good to have you here. We've got some folks that are on here with us this afternoon. Becky, looks like we've got Eric, Christy, Richard, Sandra, Tim, Vincent, William. It's good to have everybody here this afternoon. Again, let me introduce myself once again. My name is Eric Ogea here at American Business Systems, and I'll be co-hosting this webinar this afternoon right along with Patrick. How to get to know ABS? Well, that's a great question. We want to make sure that you know how to understand how to navigate through everything. First place you're going to want to land is our website if you haven't already been there, absystems.com. You'll certainly want to go through all of that information that we have online about us, the business package, income potential. The news is where our blogs are. We'll talk a little bit more about our blogs. But if you want a deeper due diligence, go right into this orange button right here, or the one here up at the top. Either one will take you into what's called our virtual brochure. Folks, this is where you'll be able to watch other videos, listen to other licensees that have been with us, some for quite some time, some fairly new, some that have one or two clients, some that have over 100 clients. So you're going to want to get into that virtual brochure and just navigate your way through each one of those sections. For those of you who would like to come by and visit us at our corporate office, we are located in Texas, just out north of Fort Worth, in a community called Keller, Texas. Come by here and join and visit us. Give us a call and then come by and visit us. A lot of people ask about our Better Business Bureau rating. It is an A+ here at the Fort Worth Better Business Bureau. You can certainly go check us out there. I mentioned to you just a minute ago about our blog. Our blog is very large. Adam Phillips, the president of our company, keeps us up to date all the time. And whenever I say all the time, I mean just about every day. We've got new information, whether we're interviewing licensees or whether we're giving you information about the Affordable Care Act, whatever it might be. All of that information out there for you to use as part of your due diligence. And for those that like to follow others on Twitter, you may follow us at AB Systems. Just log into there, get your pick up our handle there. Join us, and again, you'll get all the blog feeds right directly directed to your Twitter account. Folks, our next class, other than next week, is already in 2014, January the 20th through the 24th. I know some folks that wanted to come to our December class, but just for reasons for family and everything else that's going on here at the end of the year, is not going to be able to make it until January. So, folks, we do have one of our classes already locked in, ready to go for 2014. So if you're interested and you're looking at getting started here at the early part of next year, it's a great year to start. And let me just tell you real quickly, 1 year from now, doctors have to be on an EMR system. No two ways about it. So there is a 1 year window to jump right on here and get as many clients as you can. It's going to be a great, great year. Let me introduce you to Patrick Phillips. He is our CEO and founder of American Business Systems. Not only is he our founder, he has written several books, several magazine articles, and one here right out of the Building Coding Advantage magazine. You'll see this. He wrote this one just a few months ago about the bright future of medical billing companies. A lot of people ask us about what does the future look like? Well, it certainly was answered in there. And in the HBMA journal, billing journal, this is one of the major leading healthcare billing and management association journal here. Patrick was asked to write another article on you need to adapt in order to survive. And this is about that EMR I was talking to you about earlier. So you might want to go out there and find that article, or let us know. We can maybe be able to send you a PDF of it. He's also authored a couple of books. How to Reprogram Yourself for Success is the one on the left. Very good for those that may just be thinking a little bit less of themselves and you want to make sure that you are going to be successful. That's a great book to pick up. You can pick that book up at Amazon.com. Or the one on the right called Cash Crunch to Cash Flow. Now, folks, once you become a licensee, you're gonna find out to be one of your greatest marketing assets that you have is this Cash Crunch to Cash Flow. Well, listen, folks, we're well into this webinar already, and I want to bring in again Patrick Phillips, who is again our founder and CEO. Patrick, are you there? Oh, you're muted there.
Hey, sorry, I pushed the button on my mic here. See, it is live.
It is very live.
Okay, well, Eric, I thought I would just turn on the video here. You might want to do that too, unless you are embarrassed as to how you're dressed today. I
Oh,
know you
no,
work out of
no.
your home.
I'm right here. Here we are.
Okay, good, cool. Well, hey, let's start by telling them a little bit more about how to get that, questions going there. I
Sure,
think.
absolutely, folks. We're going to put up a screenshot here. I think Patrick, I may be stuck on this next live training date. I'm not sure where we are right there. So if you want to get to there about how to ask a question, we're going to kind of teach you and show you how to make that dial in. You're going to go right over to here where it says how to ask a question, and you're going to change from mic to speakers to use telephone. That's what we want you to use this afternoon. We've tried to do this once before using mic and speakers, but we get so much feedback. It is very hard for everybody to hear at once, and we can tell whether you're on the mic or on a telephone. And for those that are on the telephone, we'll be able to mute you here just shortly. Now, here's the number you're going to want to call into or dial into 646 307 1720. Then once you put that code, or once you get that, it's gonna say welcome to our webinar this afternoon. Then type in that access code 251-706-813, and then pound. Then underneath where your telephone portion of it is, there is an audio pin that you're going to want to type that in there, followed by the pound sign. So while people are starting to dive into this, Patrick, let's just go ahead and start taking a few questions, or you can just go ahead and get started on whatever you want to get started on.
Okay, well, I think that would be good to see. First of all, that we've got a few people. Actually, I see them typing in some questions right now, so that's good. And we'll also be taking some questions live. Hopefully, if people are actually calling in on the phone number that's on the screen there. Do I have that showing now? I don't think so. Yes, it is showing, isn't it? Okay. I have to look over here at my laptop to see what people are seeing. I've got another
Yeah,
slide
we
here that
got.
has that a little bit bigger. So remember, your audio pin will be a unique number for whatever it says there on your screen. When you switch to telephone, it will show you the phone numbers that you see here and your pin and your audio pin, and that will show us on the screen who you are. We kind of match that up with who you are on our list of attendees, and we can actually see your hand if you want to just raise your hand that you're ready to ask a question. So I know we've got a few people actually on the phone line already, don't we? One or two at least I see here coming in.
Yes, we
So
certainly do. Let's. Ron's got his hand raised, so let me go ahead. And Ron, it says your pin is not entered in yet. So, but let's see if we can send to enable muting. And let's see if we can. We're not able to unmute you just yet until you hit that. It says send audio pin 37 not entered. So Ron, you might want to try that. Now it looks like we've got William. William, you're going to be up here. We're going to see if we can unmute you here. So we've got Patrick. We've got William Walker on the call with us this afternoon.
Hi, William. How you doing?
I'm doing just great. Um,
Good.
I'm been listening to your webinars for a few weeks now, and I'm really impressed with what you have to offer. But the one thing that gives me the most apprehension, in which I haven't been able to find any statistics about, is the market saturation for the area where I would be starting this business if I was to pursue a licensee registration. So I would want to know, how can I find that information to see how many other medical billing companies are available, or that I would be competing with within in the area where I'm at.
Okay, so William, are you specifically asking about other billing companies that are just already there doing billing for doctors?
Yeah, I mean in general, yeah. I
Yeah,
mean even if they're AB systems like licensees.
sure. Well, one of the ways you can do that, William, is we actually have a little tool there. I don't know if you've seen that on our website or not, but there's a tool on there that will kind of answer your question. Let me kind of put this up on the screen, and we'll kind of look at it together here and see if this, helps at least. Uh, we don't know, of course, any more than you do, to tell you the truth, about how many licensees in other companies are out there that might be marketing in your particular area. But we do know that we can show you exactly how many doctors are in your area. So that kind of gives people a feel for that. Everybody has that same question, William, about competition, because they're always concerned about that at first. And then if you've ever talked to any of our licensees, have you called any of our licensees, just from some of the references
Yes,
we've given you?
yes,
Yeah,
I've talked to I even made a request from the agent that I was dealing with that I speak with somebody who was newly licensed registry. So because I wanted to speak to somebody who has some decency of experience with starting this business practice. I mean, somebody who's been in it for 8 years. For me, I mean, their experience as a new person may be a little bit far removed from what I would be facing. So that's why I wanted to speak to some people who are new
sure.
to the practice.
Let
But
me just, while
at that
I'm, go ahead.
opportunity, I did have that opportunity.
Okay. Well, the reason I ask that is because the reason we give out the names of licensees, and some of them are newer and some of them are older, like you said, have been with us for a while, is so that you, as somebody looking to get into this business, have a better feel from the people that are actually, have they made the decision that you're trying to make? They've been through the training, they have experienced our support. I mean, let's face it, Eric and I could say just about anything, right? So by hearing
Correct.
from our actual licensees that are all over the country, you get a better feel for that. And I think if you ask any of those people a question about competition, that they would say, that was a big concern of mine at first, but it's not such a concern now because I realized that there's no way that I could possibly cover and contact, all the doctors in my area. It's just impossible to do that. So but I was going to show you the blog there too. I guess you've probably gone there under news there on our website. You'll see blog. And this is where we post some interviews that I've done with licensees on a regular basis. Let me just scroll down here and see if there's any on this particular page. There's some testimonials from our training. And well, yeah, here's one right at the very bottom of the first page there. This is Scott Mathewson. And he came through training in May of this year. So, I mean, the average licensee is not going to get up and running probably for 30 days, maybe even 60 or 90 days, depending on what else they've got going in their life, William. So, for him to come through in May, and then I think he says he's got his first business there within the first 60 days. Then that was May, April, May, June, July. So it was somewhere in July that he actually, got started. So these kind of people will give you some feel for that the market is out there is so huge that it's kind of hard to tap into it even.
Right.
Adam, Patrick, do you mind if I jump in here just real quickly and kind of help Williams to answer his question? As a matter of fact, I was talking with someone this afternoon about competition and saturation of the market. Here's one thing to always understand. First of all, doctors are always doing medical billing, whether they're doing it in-house or whether they've got it outsourced. So that's one good thing to also understand. But I'm telling you, going into 2014 is going to really be a game changer because if you really think about it, not only are we doing medical billing, we are also provide the doctors an EMR system. And William, the doctors have to have an EMR system by the year 2015. Well, that's good news for all of us that are on the call today, and for those that are looking to get into this business and those that are already in the business. And one reason why that is because the last count that we have, there's over 1,700 EMR systems out there on the market today. Out of those 1,700, there's only a small handful. And whenever I say a small handful, I'm talking about 20 EMR platforms out there that have already met the meaningful use stage 2 criteria, which means that there are a lot of doctors out there who are on a lot of other different systems that those are going to start going away and going away pretty quickly. So your market share, although it may seem saturated right now with EMR, electronic medical records, our EMRX, the pool will actually get larger throughout the year.
Okay.
Yeah, we're like you said, we're just one of a handful of technology people that have that type of thing in place already. But let's go back to your question about competition. One of the things you can do there on our site is up here under this income potential, find doctors in my area. So what area are you in? Do you mind sharing that, William?
21133. Yeah, I actually did that.
Oh, you did.
Found
Okay.
a lot of and I found a lot of registered doctors. But I mean that just shows a potential pool. But that's not. I mean, there's always some apprehension when you start any business, and again, I guess in this business, in any sales business, is whether or not you can get clientele and how saturated the market is
Yeah, that's true.
that you get into. Yeah, just to know that there are a lot of doctors in my area doesn't necessarily tell me that they don't already have EMR systems. Um, but yeah, you don't know until you go and talk anyway.
That's
So I
that's right.
understand that. That's my apprehension. I mean,
That's right. Well, everybody has
already
that. Uh,
I've
I don't
already
really know how to
decided that I'm
solve.
going to say it again.
Oh, sorry, William. I was interrupting you. Go ahead.
I've already decided about myself that I'm committed to this opportunity, and I'm going to pursue it, and I'm going to become a licensee. So even though I know that, I have some obligations right now that wouldn't allow me to attend training before March.
Right.
But if I pay my licensee fee, I mean, is there some type of training that I could get online in order to start this before I can come down there for the actual training?
Yes, William, great question. We have, what would you say, Eric? Probably 40, 50 hours of video training on our private website for licensees.
That's correct.
Okay.
Yeah, there's a lot there. You certainly, there's sometimes we encourage you if you can't make it to that particular one, then certainly there are things that can be done prior to getting here to training. But William, we do know this that 2014 is really going to be a real game changer in the EMR world or the electronic medical records world. And Patrick, that kind of goes with another question that Cotty is even action. He typed in. He says most of the doctors have their own systems and do not want the EMRX. Is it possible to have to be effective? And I think we're going to find out that we're going to be very, very effective. So, William, we thank you for taking some time with us this afternoon. We do have some other people that want to ask a question. Do you have any other questions, or do you want to just put us on? We'll put you on mute. If you've got another question, you can certainly let us know.
No, I don't have any at this time. I may get something when somebody else asks something because it may start something. But I look forward to meeting you both.
Good.
Excellent.
Thank you, William. I would like to show Eric we kind of mentioned the fact that there is some training out there that you can go through on our private website. Now, I've already logged into it, folks. This is our licensee support site, as you can see right here. And this is given only, of course, to our licensees. But once you've logged into this, look under Train and Motivate here. There's coaching archives. And so when you go to this, you will see that there are literally just dozens of recorded training modules that you can go through on everything from each one of our services to how to market, pricing, proposals, medical billing 101, the basics of coding, networking. I mean, it just goes on and on. And I just wanted people to see that there is a lot of stuff outside the week-long training that we do here live in Dallas.
All right, Patrick, you ready to take another call?
Yes.
Okay, I think we got Ron Davis. He was able to get that code put in there. Ron, are you on with us this afternoon?
How you doing, guys?
Hey, Ron.
Good to have you here this afternoon.
And William, I certainly understand your apprehension because I feel the same way.
There you go.
But I wanted to talk. I know you guys have talked a lot about Obamacare and how that's going to impact the industry and so forth, and how we can take advantage of that. And there's still some things that I'm very concerned about. Okay, and it basically comes down to two questions. One is Medicaid, and it seems to be that a lot of the doctors are not accepting Medicaid, with Obamacare. And well, let me get back to that. The second part of that question, or the other part of that question, is already Obamacare hasn't even got off the ground yet, and 6.5 million people have already lost their health care coverage. Now, these are people who are clients of insurance companies. These are your clients, and if they have to be impacted, they have to have an impact on AB systems. Thus, they would also have an impact on us as licensees. Now, you take that a step further, if you think this through a little bit more, when the employer waivers expire at the end of next year, you're going to have upwards of 80 million people losing their health care coverage. And a vast number of those plans are family plans. So if you stop and think about it, if you just use some rough numbers, an average family is 3 to 4 people per family, and let's just say 80% of the 80 million, are families. I mean, you're looking at 250 million people or more going to be losing their health care. Now, that's going to throw this entire thing into a flux here. So on the one side, you're going to have these millions of people, millions upon millions of people now have no choice but to go into the Obamacare, website. The other, on the backside of that, you have all these doctors, thousands upon thousands of doctors who are not going to be accepting Medicaid. Okay, so this is the thing that I'm trying to get my head around. How is that going to impact you guys? When the industry is basically going to be turned on its head. So
yeah, Ron, those are great questions. Let me get something here that'll help with that. Hold on just a second. Okay, I've got it here. This is going to help. If I could see in this crystal ball right now exactly what the future holds for the Affordable Care Act, I would be a very wealthy man, probably, right? Because nobody knows at this point. It is in flux right now. I guess that's a good word. It's a very disruptive thing to the whole healthcare system. What we do know is this: we've already been through this before. There is a form of right now, single payer system in place in the United States. It's called Medicare, at least for everybody 65 and older, right? That came about in 1966. And all of the problems that you're seeing right now with the Affordable Care Act also happened when Medicare was brought in. Everybody said, oh, nobody's going to be able to get insurance and it's not going to be covered. And there were all kinds of problems then, just like there are now, is what I'm saying, Ron. So all we know is this: there are 30 million, whatever that number is, we don't know. It's 30 million is what I've heard, uninsured Americans that need some sort of coverage. People are going to continue to get sick. The only reason we have health insurance and the healthcare system is because we're human beings, right? We get sick. We have to go to the doctor. Somebody will be going to the doctor in spite of the fact that they don't have health insurance. Now, that means that some people are going to have to pay on their own, right, for themselves. But it also means that some doctors are going to have to take in more patients and take on more of not just the exchange, the exchanges in the ACA, but also those people who are just going to be basically covered by something like Medicaid. So I don't know how to predict that either. I just know that from what we've seen since 2008, when the whole ACA came about and was mentioned by Obama, that everybody in this industry has said that it has been a boon to our industry. There are doctors who don't want to mess with all of this, and yet they are messing with it right now, meaning they're using their own staff and their own software in their own office to do their billing. Somebody has to do the billing. Just like with Medicare, somebody's doing the billing and somebody's getting paid. So, the point is, everybody is going to eventually have to recognize that the doctors are going to have to get paid by somebody, unless people are paying cash, and that's a possibility that some people would move to a cash, system. I don't think we'll ever see 100% of people, because not many people can afford to pay for all of their health care by cash, but some will. So
okay, that leads me to a follow-up question, and I appreciate that, Patrick. Does AB Systems have any mechanism or any thing in the works to maybe manage the cash inflow of a doctor's office? If a doctor's not going to be taking people from Medicaid, and a lot of people don't have health insurance, a lot of doctors will still take people, but they'll accept payment plans. Does AB Systems have some way to manage those payment plans?
Yes, we have a system called Choice Pay. That is one of the systems we have in place for doctors to give patients an option of having money actually paying out their bill through a withdrawal from their credit card or their checking account each month. So it's an automated payment plan for the doctors. Then we have a patient portal that's tied in with our electronic medical record system that allows the patient to go online and actually make those payments anytime, 24/7, from any computer-connected device.
Okay.
And then on the back end, of course, we also have Quick Collect, which is our system for collecting from patients who decided not to pay. And that's a big problem for doctors right now. 50% of all the billing that they do for patients directly is not paid. We can increase that up to 98% with our Quick Collect system. So yes, we've given quite a bit of thought to that side there. But let me go back to the insurance, because I know that's a problem in a lot of people's minds as to what's going to happen from the insurance standpoint. Now, in spite of what we're seeing right now on the healthcare.gov site, all the problems that they're dealing with right there, we will look back a year from now or 2 years from now and realize that those were glitches, and that we got through that. I mean, assuming that Obamacare is not repealed completely, which I don't see that happening. So in our lifetime, things are going to change, but they're going to change for the better for people in the billing system. Listen, we're part of the Healthcare Billing and Management Association, who has a voice in Washington. They've gone there and actually sat down and visited with the people who are directly responsible for all that's going on in the healthcare field with Obamacare. And they've said themselves in meetings with them that this is not going to go away. Look, the biggest supporters of the ACA were the insurance companies. They were the ones who supported it and put more money into it because they did see that it would be that many more clients or customers for health insurance that they will get. So again, we're on a bumpy road right now, but I see a very bright future ahead for people in this industry. That's just my view on the crystal ball there. Who knows whether I'm right or not?
If I could interject there also, Ron, here's a bit of information that again, you're asking where we are moving forward with a few things. Uh, there are new requirements for doctors going into 2014 for meaningful use stage 2 that is going to require doctors to have at least 5% of their patients begin to start using the patient portal side of everything. Now that's a big task, and the reason I bring that up is because it's only going to expand from there, and this is going to be an exciting time because it's tying back a little bit what you were asking about. What are we doing to possibly be more cash payers on the system? And that's one of those areas of where we are able to educate our licensees to actually educate their doctors. Now, where we're getting those doctors flipped from their EMR system over to our EMR system, which will also lead to the billing side of everything, is the fact that we're able to help these doctors understand and navigate through these things. So you pose great questions. You've been listening to us for a long time. You've been thinking about this for quite some time, and so your questions are very thought provocative in where we're going with this industry and how it's going to impact us globally here at ABS with our licensees and then with our doctors. I can tell you for a fact that I was meeting with one of our doctors yesterday through our research and development side of everything, and I'm telling you, they did not even know about this new requirement going into 2014, and I could have punched him over with a finger going and him asking the question, how am I going to get my patients to start using the patient portal? So those are some things that are going to help us and promote us to be the leaders in the industry. You being as a leader in the industry, do we have all the answers for Medicare and Medicaid? I know that you mentioned that a lot of doctors are going to stop using Medicare or stop using Medicaid. There are a lot of doctors already doing that already. But then on the other hand, there is just as many doctors that I see signing up for Medicare and Medicaid. So it just seems as many as I see leaving, I see just as many doctors going into it as well. Those are our findings, and that's one of the benefits, Ron, and those that are on the call with us today that you're going to find here with ABS is these questions that seem to stump most folks. We're right involved and right in the middle of all this, and hopefully we're going to be able to find all the solutions for what these doctors are going to be needing. Bottom line is we need health care. Bottom line, there are going to be doctors out there. Bottom line, they're going to have to figure out a way to collect. And we're looking at all, not just the medical billing side of it, but as Patrick mentioned, even the choice pay side of it, all those other sides that we see there. So there you go. Hopefully, Ron, does that help answer your question? We don't certainly want to let you go without answering your question there.
No, you did hit it. I do certainly appreciate it. Thank you.
Very good.
Gives me more to think about.
More to think about. Well, very good. All right, Ron. Well, just click raise your hand when you want to ask another question, and we'll go on and keep going on here. Thanks so much, Ron, for joining us.
Hey, Eric.
Okay. Yes.
I do see a question that was typed in here I'd like to address.
Yes, let's go right ahead.
It's from, Althea, she says, will I be able to provide services to other healthcare providers other than physicians? That is, home healthcare agencies, and I guess that's what she has in mind. But yes, the answer is yes. In fact, when we went to that site earlier, I didn't get to go into that in detail, but look over here to the left. When you click on that link there on our website to find doctors in your area, you're going to see a list of the types of medical providers that you can provide your services to, Althea. There's not just family doctors and medical providers in general, but as you can see over here, it's a long list of types of providers. Anybody basically who's been filing directly with Medicare or private insurance, those are the types of doctors and providers of all kinds that you'll be able to provide the services for.
Exactly. Let's see. Who else we might have on going up for a call? While I'm looking, why don't you see if there's anybody that's typed in any other questions? Actually, you might want to address that one there from Katie, Cotty, KDI, about can someone outside of the U.S. start this business?
Well, yes, that's a great question. Actually, our healthcare system, of course, is completely different from, she's asking specifically about Canada, but we do have licensees in different parts of the world. It's just that you can't bill, Canadian doctors, of course, for Canadian doctors because theirs is a completely different healthcare system. Same way with every other country in the world. The United States has a particular set of codes, for example, that these doctors use when billing insurance companies and Medicare and Medicaid, and soon to be, of course, the ACA patients as well. So you have to bill for doctors within the United States healthcare system. That's the answer to that, basically. But you can run the business, of course, from anywhere in the world because it's cloud-based, and all you need is a computer with an internet connection.
There you go. Real quickly, William, you had your hand up. I'm not sure if you wanted to get back on. If you want to, I lowered your hand. And if you want to get back, oh, okay, he does have a question here. So,
there it comes, yeah.
Okay, here we go. Let's pull William back on in here. William, you're on the air.
Actually, I didn't have a question. I guess I got confused about which way the arrow goes when your hand is up.
Hey,
sorry about that.
That's okay. It proves this is live and unrehearsed, right, William? All right, let's see. Here's one that's been typed in, Eric.
Yeah, let's go ahead and take that.
Let's go back to these then, since people are seeming to be very shy about. Now, I see 2 or 3 other people on the phone. They just haven't raised their hands, so we wouldn't know whether they wanted to ask a question or not. But I do see 2 or 3 others listed there, Eric, that have actually called in on the phone.
I think Marcia did. Let's see if we can. Are you ready to take another live call here, Patrick?
Yeah, sure.
Okay. Marcia, are you there?
Hi, how are you?
Hey, Marcia, how you doing?
Good to have you this
I'm
afternoon.
fine. Actually, it's Marcia. You can call me Marcy.
Yeah. Marcia?
Okay, thank
Marcy?
Yeah. Look, first of all, I would like to say you have a wonderful program. And I know the 2 guys before me, they had some valid concerns regarding the health care, the Affordable Care Act that's in place now. And I just got to say, people are always going to need a physician, whether they're on Medicaid or not. I think it's just the process of some physicians getting over the fact that, okay, we got to accept Medicaid now. Guess what? They've gone to school all these years. They're not going to give up their practice because they have to receive Medicare payments or Medicaid payments.
That's a good point.
Trust me. And my profession has always been healthcare. I have a bachelor's degree in health services management. I have an associate's degree in health information technology.
Wow.
So I am very experienced with coding, medical billing and insurance. I've taught at the higher level of education, medical billing and insurance, and medical terminology. I just recently moved to a new region, my husband and I. And this has been my goal to start my own medical billing practice. But since I've just moved to this region, we don't have any family here. I don't know anybody. So my concern is, how do I get started not knowing anybody?
Great
Oh,
question.
that's a great question.
I know that's Patrick. You take that one. That's your favorite one to go down.
Yeah, because we've had other people come through that have had the same question, Marcy. In fact, I'm thinking of one that I interviewed here recently. It may be out there on the blog still. A fellow named Rene Hermes. He came from Croatia, I believe, to the United States. Didn't even speak English. This was only maybe 3, 4 years ago. Didn't know a soul. He's in Chicago, by the way, which is a big city, but he did not
Yes,
know
it is.
one person. Sorry, did you say something, Erica?
No. She was just commenting. Yes, Chicago's a big city.
Yeah.
Go ahead.
Oh, yeah. So anyway, he will be doing this year, Marcy, 6 million in billing for doctors in his area. So he just did exactly. And if you talk to him yourself, you're welcome to call him or visit him. As far as that goes, he's got an office there in Chicago now. He says, Pat, I just did exactly what you taught us to do in the training. And so there's no secrets about what we teach. In fact, we've shared many of the things that we actually go through in the training on some of these webinars. But one of them is learning how to network in the business community. We know the people to connect you with in different communities to be able to find those connections, because everybody knows somebody else, right? So your first client, Marcy, I can tell you, is going to come from somebody that you've made a connection in one of these business networking meetings, who happen to know somebody who's expressed maybe a dissatisfaction with their current biller. They know somebody in the medical billing industry. So it's kind of it's not a warm market. A warm market is like the people you know. You don't know anybody, you said. It will be the people that you begin to get to know in those business networking meetings. Now, that doesn't happen overnight. You're not going to get your first client the first meeting you go to, but you will build some credibility and trust with those people after meeting with them 2 or 3 times, and then you'll start getting those referrals. And I can just tell, talking to you, Marcy, with your personality, I think you're not going to have any problems making connections.
I'm so excited to begin. I really am. And I just feel like healthcare it's really getting ready to broaden its horizons. I really do. People are sick. People need health care.
Yes.
This is something that's not going to go away.
That's a good way to
And I'm ready to dig my feet in and just go for it. Actually, I just moved from the Midwest. I used to live in Indiana. Now I'm on the East Coast in the Metro D.C. area. I live in Maryland.
Oh, okay. Hey, that's a big medical area up there. Lots of huge, famous medical centers up there.
Yes, it is. And I think I'm in the prime location. I just need to attend some of your classes to really get my boost and get myself going, and then I think I'll soar.
Very good.
That's a great attitude to have. And Marcy, thank you for calling in. By the way, this is I'm going to put up our guarantee. Some of you have heard this before. We have it in writing in the agreement. And the reason I'm bringing this up, Marcy, is because when you come to our live training workshop, there's no way you can know everything there is to know about this business. You can't do all the due diligence you need to do until you've actually gone through all that we cover in those 5 days, right? So I came up with a guarantee that's unheard of in this industry. There's no other company that will let you go through their training and learn everything they have, all their secrets, and then if you don't like it, you get your money back. But that's basically what we have said here in this guarantee, and we've actually done this. There have been 3 people in the 20 years we've been in business that have actually asked for their money back at the end of the week. So that's what it's for, is we want people to feel very comfortable that this is the right business for them. It may not be for you, and there may not even be a way to know that until you've seen all the different ways that we teach about how to get clients, for example. Once you've seen it all, I think, but the facts show, the numbers show that most people will say, yes, this is something I can do. And then they go out and do it.
There you go. Patrick, we've got. It looks like someone else that might want to, and I believe Cotty. I believe I've got your name spelled properly, or said properly. I'm going to
Right.
unmute you. It looks like you're on air with us. Are you here? And you go ahead and ask your question. I think you typed it in for us.
Yes. My question is, at present time, when you go and solicit business to doctors, they already have some kind of system. Now, we here at ABS are suggesting EMRX system. What if these doctors don't want to get this system and they say, well, use my system. Can we still do it, and will it be effective?
Good question.
Yeah. So, go ahead,
Patrick.
Eric.
Oh, okay. I'll go ahead and try to answer that one. And yes, you can. There are some times that you might, just to get the doctor, sometimes you can use their system in the beginning. But again, going into it, Cotty, is that you're going to want to educate these doctors on some of the things that we're educating our licensees on right now, going into 2014 for the stage 2 meaningful use requirements. Here's one thing that's going to be key, and Patrick, you kind of know about, well, not kind of know, but you know about this. Come October of 2014, that time we're going to switch from codes that are called ICD-9s to ICD-10 codes. And the moment that gets switched, if those doctors do not have their systems loaded with the proper codes, which ours already have them, they're already there. We can actually help the doctor map out their ICD-9 codes to the ICD-10 codes now. With that said, if those doctors are on their older systems, do you know that when they go to file, they will get zero money? Everything will stop for those doctors. So we have an opportunity in the next 10 and a half months, basically, a grand opportunity to get doctors not only mapped out, like what Patrick has there on the right-hand side of that screen there. That's called a super bill that has all the codes on it. Well, those codes have the old ICD-9 codes. You, as a licensee, can literally take that piece of paper and map out the new ICD-10 codes on there for a fee for the doctor if you'd like to, even if they're not using their system. Okay. So with that said, I think what you're going to find, Cotty, is that you're going to find doctors who have older EMR systems that are not ready. You're going to find billing systems that are not ready for the ICD-10 codes moving forward. I think you're going to find a lot of doctors out there that are going to actually be, they may say no today, as Patrick has said. What they say no today may not be the no tomorrow. That's why it's going to take the time now to start educating those doctors currently. Patrick, you want to kind of take it from there?
Cotty, so are you asking if the doctor already has a system and they're happy with it, can we do their billing?
Right.
Yes. In fact, I would say, Eric, wouldn't you probably, the majority of the new doctor signups that we're seeing from our licensees from coast to coast are all with doctors who are theoretically happy with the system that they're currently using. So
Correct.
Many of our licensees are doing their billing through our iClaim billing system, but they just tie in with their current electronic medical record system. So there is a way to have that connected to another system so that it works fine. Now, once we've shown them the live demo of our EMRX system and they see all the advantages of it, some doctors go, "Oh, well then, yeah, we're switching," but they don't have to.
Okay. All right. Thank you.
Yes, thanks for calling in.
Oh yeah, you're welcome. Thanks, Scotty.
Thank you.
Okay. Let's see. I'm looking at our time. We've got about 10 more minutes here, Patrick. Let's take a few more typed in calls or typed in questions here. Let's see what we have here.
I've got one here from, let's see, this is Althea again. She says, what is the approximate amount of funds do we need for operational expenses during the initial phase? So Althea, I think what you're saying is, in addition to our licensing fee, which those of you who've been doing your research know that it's about $25,000, that is a fee that covers your training and your lifetime support, your access to our private website and our forums, the ongoing webinar training that we do every week here at ABS. That's all a part of that fee. The only other fees that you're going to have are fees that are directly related to the billing that you do for the doctors. And the doctors are the ones who pay those fees, not you. So your operational expenses, of course, could include, of course, maybe if you don't have a computer, you need to buy a computer. They may need a phone line, a specific phone line for your business that you can, use just as an exclusive business line. Although a lot of our licensees just use what we call a virtual office line, an 800 number that will ring any number you tell it to when people call it. There's lots of ways that you can run your business, but most people do not have large amounts of expenses over and above what their time is involved in getting their clients. We provide you over 2,000 pieces of our marketing materials, which we have found is more than enough for people to get their first client. So there's not a whole lot of expenses outside those that I just named.
Exactly. Patrick, what about this is a question that's coming in from Glenn. Glenn's asking the question about any plans for dental billing?
We've looked at that over the years. For the past 20 years, we have not gotten into the dental billing, and there's several reasons for that. One is that if you think about it, amongst your own friends, not many people have a full-blown, covers everything kind of a dental plan. They have little supplemental plans that will pay maybe $25 per visit or whatever, but there's no true there is true health insurance, dental insurance, but it's very expensive. So what I'm saying is not many people have it. Therefore, the market is very small on that. Now, it doesn't mean that you can't do billing for dentists. We have other partners that we can put you in contact with once you get into the billing business and want to do medical billing for dental. But there's just not a whole lot of, and dentists don't see near the patients that doctors do on a regular basis either. So a big portion of theirs is self-pay. Now, we tell people this, look, if you go out and sign up all the doctors, all the medical providers, the thousands of different types of medical providers in your area, and you decide at some point that you want to do medical billing, then go after the medical prospects that are out there. But we don't encourage that at first. That's just not where you're going to make your money.
Right. We certainly believe the money's going to be made here in the medical division aside of everything. William typed in the question, Patrick, about the super bill, the one that we've got up there on the screen right now. And he asked the question, how is the super bill given to the licensee?
That's an interesting question because with most other companies that are out there, they will tell you that the best way to do it is maybe to have it faxed to you or emailed. There's all sorts of problems with faxes and emails because of the fact that some of those things are not HIPAA compliant. That is, they don't protect the patient information like it should. So we've gone to what we call an online document management system called iDocs Now. And you'll see that on our website if you want to read more about that. But it is basically a way for you to get all that information from doctors sent to you electronically. And you access it from the web 24/7 with any computer connected device. And you don't have to worry about having to go pick it up or have it FedExed or even faxing or email. This is a much better way of doing it through iDocs Now. You'll see that in one of the brochures that I'm going to put up here on the screen. Down in the bottom right-hand corner, there's a document there that's about iDocs Now.
Yeah, and real quickly, William, and again, you typed in your question, so I want to kind of answer maybe the other side of that. What you might be thinking about is how would you, as a prospect, get that? You can actually If you're when you're out there marketing to doctors, and you've got a doctor that says, yeah, they can give you a blank super bill. Also, this is without doing the billing. This is just doing, you could certainly say, hey, I'd like to see if you're prepared for the ICD-10s. Do you have anybody that's going to be doing your conversion of your ICD-9s to the ICD-10s? That may be one other way that you could actually go out there and get some of your marketing done as well. But on the side of what Patrick's talking about here, this would be how you receive those super bills from the doctors that actually have the patient demographics on it, and then for you to actually do the billing for that. This is one of the best ways to be able to do that there, right through iDocs Now.
Yeah, as part of your setup fee with a doctor to get them started, you can include a scanner that you put in their office. And at the end of the day, somebody there in the office, their job is to put all of the super bills and the new patient registration forms into that scanner, push a button, and boom, all those documents are now in the cloud. And you have access to that account, of course. You log in and you manage those documents through your computer, not through paper. There's no paper at all involved in that process. Yeah, good question.
All right, and then one last written question here from Scott. He asked the question: what happens if ABS shuts its doors?
Well, interesting that you asked that because, we're one of the few companies that have been around for 20 years. We have seen a lot of companies come and go in this industry. The reason that we've been around, and I trust that we'll be around for some time, is because we've built our model on making money on the transactions. In other words, each claim that goes through our system, we're making a few pennies on that. Now, remember, the doctor is paying for that. It doesn't come out of your pocket. But we get a few pennies for each one of those transactions. And the same is true with all of our services. So ABS actually makes money the more transactions that you have. And as we've grown over the years and added more licensees and they add more doctors and there are more patients seeing those doctors, that just means an increase in that back end revenue for ABS and means that we'll be here. Now, after having said that, when you come to our live training, you'll see that we introduce you to technology partners that are behind all of the things that ABS has put in place. Those technology partners are some of them multi-million-dollar companies that you are now in partnership. So we introduce you and put you into partnership with a half a dozen other companies that have over 500 employees all total. And those companies are there solidly behind the scenes, processing the claims and doing all the services for you. ABS is just the training and support company that puts you into the business. So even if we went out of business, you're still in partnership with all those technology partners, and it wouldn't change. Our licensees that are out there doing business today, their business would not even change. They'd probably feel sorry and may send flowers to me, but that's about all I'd get.
That's about all we would get. Well, Patrick, it looks like we're almost up at the top of the hour. We've got about 2 more minutes left. Let's put up a couple of those last slides that you have here. One being our upcoming training. One will be here shortly, right after the December class. We're going to have one in January, and I think we've got those dates there as January 20th through the 24th. We want you to give us a call here at 866-565-8413. So just give us a quick shout here, and we'd love to have you and get you into one of these upcoming classes. Also, Patrick has already shared that screenshot with you earlier about the 100% money back guarantee. And certainly we want you to come on by and visit with us. Come on and get into this class. And again, at the end of that class, if you feel like this business is not for you, just simply ask for a refund, and we'll be happy to give that to you. Everything excluding your travel that took you to get here. Well, Patrick, it seemed like it was somewhat of a success today. We had a lot of great call-ins today, some great questions, and I know that you and I have been kind of talking about some upcoming topics. You want to just quickly share about some of the things that we're looking at discussing in future webinars?
We're going to get into some real detail about the whole ACA. and talk more about that, because we know that that's a concern of people who are looking at getting into our business. So we're definitely going to delve into that even more so than we have in the past. And guys, we do these webinars, by the way, every Wednesday at 3 p.m. Central Time. I hope you can see that we're trying to be as transparent and open as a company as we possibly can be, because we want to share with you all the good things about this industry, and we're open to taking any questions. So even if we didn't get to your questions today, trust me that we will be glad to answer all those questions, either one-on-one with you through email. You can call us, of course. You can interact with the person who you've been talking to at our office, or just continue to come to these webinars week after week, as long as it takes for you to feel comfortable that you're making the right decision. And then, like Eric said, once you're down here, if you go through the training and don't like it for some reason, you haven't spent a whole lot of time and money finding out whether it is for real or not. And believe me, our licensees would tell you that it's about as real as it gets. Well, Eric, thanks for co-hosting with me again today.
Absolutely. It was my pleasure. And again, for those that called in,